Now, Dr. Brooke gave me this, I guess, this lugubrious title of a still necessary evil. Now, I took some exception to that. I assumed the people who gave me the title thought this was my operating room and that I was working in this type of an environment. I would prefer a title like this, that surgical clipping is a necessity in certain situations. And I'll show you a few cases. I mean, look, there are a bunch of cowboys out here. If I show you one that I operated on, you'll say, oh, we could coil it. If I show you one that we coiled, some boy will tell me, I could have clipped that one. That's not the issue. I'm going to show you a few cases of and what we did, and a few reasons for it, and then some comments as to where I think the world stands at the moment. 58-year-old woman, no particular medical problems, with this large 12-millimeter anterior communicating artery aneurysm, picked up incidentally for headaches. An analysis of this thing led us to feel that this was not ideal for endovascular treatment in terms of eliminating it and being done with it. We operated upon her and reconstructed the communicating artery using 2 fenestrated clips so that the anterior cerebral goes through them and preserves them, and they're both filling here. The first day, I was extremely worried post-op. She was a little bit goofy. She went home on the 6th day absolutely at baseline. 62-year-old woman in a similar fashion, a somewhat peculiar-looking posterior communicating region aneurysm with a kind of kink in the artery here. I don't doubt that one could treat this with a stent. One could treat it with coils. We didn't. We elected to clip this, placed a clip parallel. This is both aneurysm here as well as here, the third nerve you can see in the background there. And this is a post-op picture, and it went fine. I would add that I never use the expression, it's just a PCOM. There is no such thing as just a PCOM. They are treacherous aneurysms. When you get into trouble, you lose the carotid artery, and that's not good. Here's a bit of a dilemma. This is a 23-year-old woman who presented with this subarachnoid hemorrhage, and on Dr. Brooks' very careful angiogram, all we could find was this little tiny blip on the left MCA bifurcation. I don't know about the audience here. At least both of us did not feel that we had something to offer from an endovascular standpoint. So I've shown you a big one, I've shown you a little one that we felt were better dealt with in the operating room.